All right, thank you so much for joining us today. Dr. Lee Newman and I will be presenting on false steps. What does science say about wearable technologies? Dun, dun, dun.
Hi, Josh, and hi, everybody. This is Lee Newman, and we should have an interesting discussion today. Just as a kickoff, a little bit about who we are. We're the Center for Health, Work, and Environment. We're one of the 6 total worker health centers of excellence supported by the National Institute for Occupational Safety and Health. And we also house the Mountain and Plains Education and Research Center, which is a training center supported by NIOSH as well. We're based here at the Colorado School of Public Health. I'm talking to you today from the Anschutz Medical Campus. And here we are. So keep those pictures in mind as you hear the voices. So, and welcome to today's webinar. This should be fun. So today's conversation is going to focus on 3 things. First of all, what does, where'd it go? What does research tell us about portable activity sensing devices, wearable technology? And do wearable devices help us change our health behaviors? We'll be focusing in specifically on a couple of papers today that I think help us do what we as a center are aiming to do, which is to always take the best research and put it into practice, convert it into usable terms for those of us who are engaging in the workplace. And one area where there has been some recent research that we'll talk about was a paper in JAMA this last year on whether these wearable devices help achieve a long-term weight loss. And we'll touch on a little bit on what should be the role of these devices in workplace health promotion or wellness programs.
So at the end of the webinar today, Lee and I will be answering some of your questions that you have or that hopefully you generate throughout the presentation. So on the GoToWebinar dashboard that you should all have access to, you'll be able to submit your questions in the question tab, and we'll have about 10 to 15 minutes where Lee and I will go through those questions and hopefully provide an adequate answer for you then. So feel free to submit throughout the presentation. You don't have to wait to the end, but that's when we'll be fielding questions.
So the odds are pretty high that many of you who are on the phone today are either wearing a piece of mobile information technology or maybe carrying one with you on your phone. I'd say it's pretty high. And here's some data from February 2016 reflecting if you look on the left at those circles, the fitness, activity, and sports trackers in red, people wearing other kinds of virtual and augmented headsets and things of that sort. Let's get back to our screen here.
Yep, sorry about that. There was a screen sharing difficulty.
Oh, okay. Do you need to confirm with folks that they can see this?
In the comments section, can you please confirm that you can see the mobile information technology slide in the question section?
Okay, great.
Thank you. Great. So we're going to continue now.
Yeah. So coming back to this particular slide, this is interesting because it shows the global forecast for the use of wearable devices, and it doesn't take much for me to convince you all that between the smart watches, the smartphones, the fitness and activity and sports trackers, this is a big business, and there are a lot of units being sold. I think the last quarter of 2016, just in the U.S., there are like 23 million units sold just of some of these activity trackers. Let me do one more thing.
One more. Sorry about that, yeah.
So I want to touch on this from 2 angles. I'm not going to focus today on their role in workplace safety, but in the workplace, there's been a lot of interest, and there's a huge amount, there's really a revolution going on in terms of the use of wearable technologies to improve workplace safety. So Google Glass, contrary to many of our beliefs, is maybe making a resurgence as a tool that helps people do their jobs better. Shown on the right are a couple of these sensing devices that can help detect chemicals that the skin comes in contact with. And then there are all kinds of activity trackers that may or may not have specific utility for workplace safety, but probably going to find their way in terms of helping people address things like maintaining balance and monitoring activities levels. But what I'd like to shift to more today is to focus on the use of portable activity sensing devices, also called PASDs, in the context of health promotion, of worksite wellness. And shown here just literally a handful of those devices. All right. Look, today it's going to be, we're going to have a quiz at the end on who is cheesier, me or Josh, okay? So stay tuned for that. So we're going to focus more on this aspect of it in the workplace. And wearable devices are being offered in wellness programs, but the goals vary. So you have companies who are giving these out as perks, as an incentive for engagement in health promotion activities and worksite wellness programs, as a way of promoting engagement. There are also many businesses that sell it to their upper management in the hope that there would be a return on investment if, in fact, wearing a wearable device, using a wearable device, could translate into sustained weight loss with downstream benefits in terms of health related to weight. If it can lead to health behavior change, that could result in improved health outcomes, whether it's around cardiovascular disease, risk for diabetes, et cetera. So there's been really a lot of interest in this, and you'll find in the internet literature a lot of case studies about, and there are always success stories about the use of wearable devices to help promote better health behaviors and better health outcomes. And I want to talk a little bit about that today. But I want to start from the more fundamentals, in my opinion, which is really going to what does the research literature tell us about the merits of these devices. So, welcome. This whole conversation today is really about the world of behavioral informatics. So welcome to the world of behavioral informatics, which holds promise in two directions. One, as we collect this information, these devices are really powerful tools for us to be able to measure, store, and communicate health information. On the lower left, Josh, you know what that is?
Is that a taser?
That's a cattle prod. Yeah. So yes, in a way. And the way that the reason that I include it here is because it's actually raised some concerns that we may be using these devices based on who's collecting the data and who's using the data to be a little bit of Big Brother. But nonetheless, it's powerful information, and harnessed correctly could really benefit us in research as well as in practice. But not only to look at the data, but on the right, where I talk about behavioral interventions, the real opportunity that most of us see also lies in having devices that help us monitor our own behavior. Do you want to look at how many steps you take in a day? Does that lead you to be more physically active, for example? Can it motivate healthier behaviors on the individual level and even on the group level? And some of these devices have built into them essentially built-in coaching and can be linked to other tools on the internet, which allow us to get feedback from our friends, our competitors, our teammates, and with the intent of improving our health behavior. So this is an interesting world that we've entered around behavioral informatics, and there's only going to be more of this hanging off of us as time goes on. We might as well start wrapping our heads around, well, how beneficial is it going to be? So to get at this question, and I should mention, first of all, Josh, there have been actually a lot of studies that have looked at whether these things are accurate, whether they're valid, whether they give good information or not. But I'm going to focus today on whether they actually are effective in producing changes in our health behaviors. And what I wanted to do was talk about this one paper that just came out in February, which I think is particularly nicely done. Interestingly, came out in an informatics journal. And so it's the medical informatics people have been looking at, in a systematic way, how effective these devices are. And so we'll talk about that.
So Lee, I think it's important to note for our audience too, you know, Lee and I live in an academic world, and so we get really excited when we see these systematic reviews come out, because what it means is that there's enough literature. It might not be abundant, but there's enough literature out there to give us a general sense of what the trends are in this sort of information. And so when there's enough literature that exists, we see something come out typically that's called a systematic review, which is just a compilation of the relevant articles around this kind of behavioral health intervention using PASDs. And so this came out pretty recently, February 11th of 2017, and these articles are available to you through the dashboard as well.
And you know what I'd like to do is to talk a little bit just briefly about how they go about doing these kinds of systematic reviews. So it starts by researchers having an idea. They want to know, well, what is known, what's been published in the scientific literature on this particular topic. And so they'll choose search terms, they'll go out into library databases and gather up all of the published research on the subject. And then they start going through a culling process. They start screening them to see if they're actually relevant to the topic. They'll then have eligibility criteria, which basically says, was it a reasonably well-designed study? And then they'll narrow it down even more to say, which are the rigorous research studies that have been published, and then focus on just those most rigorous studies. And so they do a lot of the heavy lifting for us. And in this case, what these researchers did was they actually identified nearly 10,000 papers that had anything to do with this subject. They then screened those and looked at about 920 of these studies in more detail. And when they really narrowed it down, they came up with a total of 17 studies that had reasonably good scientific rigor on which to base our views of what the research literature has to say about the effectiveness of these devices. That is kind of an extraordinary figure when you think about starting at 10,000 and end up with 17 rigorous studies.
It just goes to show the information we're sharing is about as good as what exists out there.
And so this slide shows, and we'll take a couple minutes on this slide, but this one shows what they, you know, the 17 papers, what were the kinds of papers that they found to look at effectiveness of these devices. And starting from the, I'll take it from the lower left, you can see that there were 4 studies that were pretty rigorous, looking at how the use of these devices could improve gait performance. So, you know, this is, you know, how tippy are people? How well are they moving? And there's a whole sub-literature on gait, the regularity of gait, our balance, and the use of these devices. And so you can see that there are the gait papers, 3 more on balance control. There are a couple of papers looking at how pedometers tied in with like text messaging and virtual coaching could potentially improve metabolism and physiologic measures like your blood pressure, your insulin needs. Up in the upper left, you can see that there have been just 4 reasonably rigorous studies looking at whether the use of these devices results in improved body measures like BMI, weight, waist circumference. There have been a couple of studies of reasonably high rigor looking at you know, how well these help people stick with it. Do they improve adherence to a physical activity program? And then really the bulk of the higher quality studies that were found, 11 of them, were looking at how effective are these wearable devices at increasing physical activity. And as you can see, some of them are tied into using the device by itself, but very often tied in with different other kinds of ways of encouraging physical activity, what we refer to as behavioral change interventions. So that's kind of the scope of the studies that they have found. I love this diagram. It's in the paper. It's very cute, and it actually had no real need to be in the paper, but it was kind of fun to look at. But it sort of, what it does is it kind of signals how these devices were combined with other behavior change techniques. You know, is it just self-monitoring? Is it tied into someone helping you as an individual not only use this device to monitor maybe your steps, but combined with goal setting? So my target is to get 10,000 steps a day. You know, how did I set that goal? And then how do I monitor it using this device, for example? And then with more integrative, more complete interventions that might include things like motivational messaging, as well as goal setting, as well as self-monitoring, and ultimately tied in to incentives as well in some cases. So you can see that the range of studies, they rarely will just look at, well, how well did this wearable device, my Fitbit or whatever it was, how well did it do in changing behavior? It's really looking at it usually in the context of some other ways of encouraging people to change the way they act. I always have to say something about why do you get from 9,000 or 10,000 records in the research literature down to looking at 17 studies? And the reason that happens is because one of the things that researchers do is they look for different forms of bias. If I were to enroll you, Josh, in a study, and I randomized you to the group that received a bracelet that you're going to wear to monitor your to self-monitor your physical activity, by the virtue of the fact that I gave you one of these and I didn't give it to the other random half of the people in my study, you already know something and I already know something about the fact that you've got the device on, right? So that's actually a form of bias that we've introduced. You're aware that you're wearing the device. The other person is aware that they're not wearing the device. So that's just as one simple example of a type of bias that we have. We also have selection bias. How did we decide who's going to be in the study and in which study groups? In addition to the problem of blinding participants to the actual thing that we're trying to assess. So yeah, I'm not going to go through all the different forms of bias, but suffice it to say that when we say bias, it means that we're identifying potential limitations to the study design, leading us to the conclusion, as these researchers did, that there's really just a couple of handful of studies that we can really trust as being highly rigorous.
I think it's also important to note too that every study that's ever been conducted has some sort of bias to it.
Yeah, there's no perfect study.
There's no perfect study. Yeah.
And certainly in clinical science, we know that there may be there may be examples of the perfect study, but they don't really exist where biology is involved or where human factors are involved. So what did they find? These researchers, when they looked at these 17 studies, you can come up with a couple of broad conclusions. One, these wearable devices may improve outcomes when they're coupled with other behavior change techniques. And the devices by themselves do not change health-related outcomes. So if you're saying, let's just hand out a bunch of wearable devices to a group of our workers, and we will expect that that's going to change their health behavior and change their health outcomes, there's not good evidence in the research literature to say that that's true. And then the third point, as I've already made, is that what we're concluding today is based on a relatively small number of highly rigorous studies. These are really hard studies to do. For any of you, and I've spent 32 years doing clinical and field studies of one kind or another, and these are tough. It's hard to do them well. So it's not to take away from what people have published, but it's just to recognize that it's tough to do this kind of research. did you have a question?
Well, I just think it's important. It's a good kind of midpoint here right now to also talk about what we mean when we talk about other behavior change techniques. If you've been paying attention up till now, you've seen that kind of littered through the information, whether it was goal setting or coaching or some of the other pieces that were built into that systematic review. And one of the big takeaways from that is that PASDs coupled with a variety of behavior change techniques seem to work better.
Right, and yeah, so I think you're raising a really good point. So if you think about what is it that gets people to modify their behavior, right? What gets any of us to change our behavior? And there are a couple of things that we know from the psychology literature. What the psychologists will tell you is that to get change in behavior, there are a few things that you need. First of all, you have to want it. You have to believe that you're able to do it. Whatever that change of behavior is, you have to believe that you can do it. There's this notion of autonomy. You have to want to do it for yourself. I want to make this change is actually really important. I'm not doing it just because I'm trying to, earn an incentive that my employer is giving me that, I recognize for myself that this is worth doing. And then the fourth thing is that we generally need, to be successful, we need a social context. It helps us to initiate the behavior and the behavior change, and also to maintain it. If our friends and family and colleagues at work, whoever it is, know that we're trying to make this change and support us in doing it. So you think about the spectrum of behavioral change techniques that are out there, whether they're related to coaching or goal setting. All of these things are tied into those fundamentals, right? It's do I want to do it for myself? Do I think I can do it, and do I have the support to do it? Great. So let's talk about one specific study that got a fair amount of media play when it first came out, and it was a study that was published in a prestigious medical journal, JAMA, and it's on the effect of wearable technology combined with a behavioral change technique, lifestyle intervention, to try to impact long-term weight loss. And this is called the IDEA randomized clinical trial. This particular study was just one part of a larger research program addressing what does it take to achieve long-term weight loss, and wearable devices figured in prominently in this study. So the issue is obvious. Obesity is a costly problem to us as individuals and to society. Interventions that focus on diet and physical activity have been shown to be effective for achieving short-term weight loss. However, we also know that keeping the weight off in the long term is tough to do. So long-term weight loss is hard to sustain, and remarkably, there aren't that many well-executed studies to demonstrate how to achieve long-term weight loss. So with that as the context, the question was, can wearable technologies help? We know that they give feedback. They can give you feedback on your physical activity levels. They've been shown to produce a modest short-term improvement in weight if they're combined with programs that change behavior. So combining them with lifestyle changes that address diet and exercise and involve coaching, etc. We know that from the handful of studies that the previous researchers referenced, that you can achieve short-term improvements, but do they help us lose weight in the long term? And we all know that for you to benefit long-term from weighing less, you have to keep that weight off. So here's their study design. So in this research, and this was a pretty heroic, big deal, complicated, challenging study, no doubt to do. They studied 470 young adults. Their BMIs were elevated from 25 to 40. And here's kind of a flow of how they did the study. So for the first 6 months that you were enrolled in this research, you received what most of us would consider to be a standard weight loss intervention. You're given a prescription for your diet, a prescription for physical activity. You're being educated around how to do that and why you need to do that. and there are weekly group sessions to help achieve that social support piece. And so everybody who was enrolled in this study for the first 6 months of it participated in that kind of lifestyle modification, now pretty classic behavioral intervention. At that point, they were then followed for months 7 through 24. So this study goes out for a total of 2 years, where they've now randomized that first group. It's like everybody, and basically split them into 2 groups. One that would receive what they would call the standard intervention, and then the other group would get what's called an enhanced intervention. The enhanced intervention means that they got a wearable device. And at that stage, these people received telephone counseling, text prompts. They had access to some online resources. There was monthly contact going on for the remainder of the study period, but they were more on their own. And they were either on their own or on their own with a wearable device as well.
So I think this is a good point to note. I know a lot of you, live in the health promotion or the behavior change world, and it's important to highlight that from this study, long-term weight loss was defined at 24 months.
Right. They were looking. That's right. They were looking for, and I'll show you the data. You can keep it off for 6 months, and there are multiple studies showing that you can lose weight for over a 6-month period, but can you continue to lose weight or sustain the weight loss?
Yeah, so long term is 2 years, and I think for those of you that work in this world, we know that 2 years is a significant hurdle to think that if you are working with an individual or with a group, to see something 2 years out is quite a bit more meaningful. So just wanted to highlight that.
Yeah, it's actually the same way if we're talking about other kinds of behavior change. So as a physician, I'm a pulmonary specialist, and there are a lot of people I encourage to quit smoking. And the data is pretty clear. The longer you go having not smoked, the more likely you are to never smoke again, right? So, this is the same principle. So here's kind of one of the rough spots in this study. Unfortunately, when they started this study, it was years ago, and technologically, it was light years ago, because at the time, the wearable technology that they chose to use was state-of-the-art, circa 2010. And it was a fit core by Body Media. I know these are still out there and people use them. I'm not trying to put them down. I'm just trying to say that we all know that wearing a constrictive band around your upper arm has been largely supplanted by lots of other devices, including ones that you wear on your wrist or et cetera. But what they did was that's their technology intervention. They gave people these devices. They deliver feedback through an armband display. They send alerts when you hit certain moderate, vigorous activity levels. If you've maintained a certain heart rate for at least 10 minutes or more at a time, it signals that you've done that. And it was tied into some web-based software that you could also use for self-monitoring your dietary intake. So this paper gets published in 2016 because it takes multiple years to do a study like this, to launch, to recruit, to track people for 24 months, to analyze your data, to publishing your data. It's not surprising that a study that starts in 2010 gets published in 2016 with the technology of that time. In terms of the outcomes, the major outcomes that they showed was that both groups, the people who received the armband and those who didn't, both groups lost weight, and they also improved their fitness, they improved their physical activity levels, they improved body composition, self-reported dietary intake of calories, fat, carbs, and protein. And after the first 6 months, the two groups had lost similar amounts of weight. So what do you think happened next, Josh?
I think we're going to have some meaningful results to look at.
Okay, let's look at it. Okay, so surprisingly, those who had worn the wearable device, called the enhanced intervention, ended up having less effective results at the end of 24 months. So let me walk you through this. So if you look at the bars in the top half, the standard intervention group, those are the ones who got the 6 months of intensive stuff, and then continue to be tracked and texted and telephoned, but were on their own. You can see the darkest gray bar at the very top. That was their starting weight in kilograms. At the end of 24 months, that next bar down, you can see that they did go down by, I think it was around 4 kilograms on average, which is pretty good. But if you look at the if you look at the net weight loss, now look at the people who receive the technology, the enhanced group, you can first of all see the darkest gray bar at the end of that shows at the end of 6 months, where they were. They were about comparable, but then after 24 months, they still had lost a little bit of weight, but their net weight loss was less than the people in the standard group, and this was statistically significant. Is this biologically significant? Is it clinically significant? Maybe, maybe not. But the take home is that at very least, having the wearable device did not improve the likelihood of you keeping the weight off, and possibly you kept the weight off less well than the people who just went without the device.
And there's nothing proven from the study that would say, well, why would we see this difference? Why might those that wore a wearable device have a slightly less amount of weight loss? But there is some speculation around whether it's dependence on it or other means, but there was nothing conclusive about that.
Yeah, there's a lot of speculation we could have around it, but the study can't answer why this particular, why they got this outcome. But needless to say, it was disappointing in that, in an ideal world, we'd like to think, oh gosh, we gave you this device, you're tracking it better, you're more aware of it, you're getting rewarded by this thing, buzzing at you when you hit your exercise targets.
We spent money on it.
Right. And it didn't end up net leading you to better 2-year outcomes in terms of your weight loss. But there are, like every study, like every good study, there are limitations. So first of all, recognize that they were studying people ages 18 to 35, so we can't readily extrapolate this to people my age. They did the study starting in 2010 and 2012, completed it in 2014. It should be mentioned that as a form of bias, they screened out a lot of potential participants, and also during the 2-year span of the study, they lost about 25% of the people who were in the study. They lost about a quarter of them to follow-up, so they don't have complete data on about a quarter of the people that they started with, and that's a limitation. There's not really a control group here in the sense of, do we have people who were followed for 2 years with no behavioral intervention of any kind, or who maybe just got the 6 months of intensive behavioral intervention and then would be let go for the next 18 months, and nobody came back and took a third group like that, and at 18 months later said, well, how's your weight? Mm-hmm. And the use of devices was not something you could control for. So if I gave you one of those armbands to use, there was no way of guaranteeing that you were going to use that on a regular basis. And I think we see that with most of these devices.
Yep. Some people use them every day, every hour, and some people use them once a week.
Yeah. Oh, yeah. Some people will use them for the first couple of weeks and get a pretty good idea of, well, okay, it looks like I, typically exercise at this level, and then they don't check in with it that often again, because they start to, have a notion of, they get the information that they wanted from it and then put it in the drawer too. And I've already made the point about this being old-fashioned technology. So the takeaways from the JAMA study, interventions do produce weight loss that can be sustained for 2 years, but you need a comprehensive program. Adding a wearable device doesn't seem to help in the 2-year long run. Now, and I just want to put it out there that different devices, different studies, different approaches could produce different results. This is just one of the best studies of its kind that's been done to date. And I always want to caution people, don't depend upon the one most recent study and basically say, oh, now we know everything. science is accretive. We build knowledge on top of knowledge. We tear down the things that we thought were right that were wrong, and we replace it with new knowledge, and then we build on that knowledge. And so put this in context. Let's see, is the forward going? So I think as far as take-homes, I hope you all can appreciate how hard it is to do rigorous science in this topic, and recognize that there is an abundance of even less rigorous evidence on the internet. So I think what's really important if it's this hard for the hardcore scientists to conduct rigorous studies that give us reliable answers, I think it's just really important to look at the things that you're finding on the internet around coming from an individual company or a consultant. Just take their claims of successes in this area with a generous grain of salt. It doesn't mean that they aren't doing good studies, but if they are not going through a peer-reviewed process, if they're not being taken through a rigorous vetting process, then what you see is what you get, and you should put some salt on it. I also want to add that if you're working with companies, or if you're working in your organization and basically suggesting that these devices be used as part of a workplace health promotion program with the expectation that there's going to be a return on investment, I think you have to be really realistic about what you're trying to achieve. You realize that if you're pitching the use of these devices, they should be pitched as part of a comprehensive approach. And because there is not that much great science out there at this point, you should at very least be evaluating the effectiveness of these as part of those programs. If you're going to commit to them and to a considerable amount of funding to purchase them, you should set aside some of the funding to evaluate how well this has worked and then adjust.
I think it's also really important that both organizations that are committing to using some sort of portable sensing device, that there is a clear establishment. And Lee, you mentioned this right at the beginning of what is our intent of using this, and because there are a whole variety of intents and goals around why people use the portable sensing devices, if it's solely being used as an incentive to motivate participation in something, then I think it's okay. Then you track participation, not the outcomes you may want to see.
Yeah, that's right. But then you're in the category of treating it like the free water bottle,
exactly,
or the baseball cap, or whatever it is in that category. So I think deciding how what your goals are is exactly right, and not everybody is saying, oh, well, I want to see that I achieved 10% weight loss in my overweight employees, and that resulted in dollars saved in our healthcare plan. And if that's your ambition, good luck with that. That's going to be a tough thing to actually prove. I think that being more realistic about using it as an incentive to participate, as a way of getting people to engage, as a way of maybe promoting some level of well-being and job satisfaction. There's some things like that I think are probably easier targets.
Communicating organizational commitment.
Exactly. Yeah. So it's I think that it's a matter of deciding what you really want to get out of that device.
All right. So this is the deciding moment of who's cheesier. But I have a question. As Lee and I were going through,
are you trying to boil this down?
Yeah, I'm going to boil this down for you. As we were going through these slides, it really struck me. I mean, neither Lee or I use one of these in the workplace on a regular basis. So the question remains, Lee is our fearless leader. Would you purchase these? Would you use these? And would you think it would be important to have in our workplace?
Yeah, I think it depends upon your workforce and, again, what your goals are. So, I look at our workforce. We're here at this center, and we've got about 27 people working in the center. And if I look around me, I see that most everybody has some sense of the value of health and safety and well-being for themselves and for the people around them. Would giving them a wearable device change that? I don't know if it would change that much. I can see settings where this could be, having one of those devices could be the wake-up call that people need, and they realize, oh gosh, I really am, just sitting at a desk all the time, and I'm, my activity levels are really low. Now, activity is not everything, right? I mean, we have other issues that may be more important to us. But if we're really focused on activity, or we have jobs where balance is important, there may be a place for them. I don't know. What would you do?
Well, I think it's important, that these articles focused very heavily on the use of activity monitors, and we work a lot in employee safety as well. And in the realm of safety, there are really cool emerging technologies that really help as kind of biofeedback mechanisms that really, I think will shape the future of employee safety, whether it's, giving them early warnings about, machines or hazardous waste spills, whether it's allowing people the biofeedback to self-monitor on heat stress. I think that in the use of safety that we may see more significant results than we've seen on activity promotion.
Well, I think we'll also find that in those kinds of settings that we'll see the science quicker.
Yep.
If you introduce use of a device that helps you maintain your balance, and you're somebody whose job involves a lot of climbing ladders, for example, that will translate in time into science that will demonstrate that we have fewer ladder-related falls, for example. So I can see some very concrete outcomes that will be easier to measure in the safety side of the house than measuring some of these things that require a lot of behavior modification support.
Yeah. So
an employer can basically enforce the use of a hard hat, for example, right? That's a very analog example, but I think that we tend to regulate, legislate, mandate safety more than we do things that are more focused on health promotion and wellness.
All right, we wanted to save a little bit of time at the end for questions. So if you want to ask anyone, please submit your questions in the questions tab. We have one question so far, and it's from Jim Lynn. It says, is it possible that people with wearables would have a set goal, set distance, steps, a day, while those without a wearable just keep doing? Any another speculation?
Yeah, no, Jim, I think that's quite plausible. The thing that these studies don't get at is, what really motivates people, right? So some of us probably, it's important for us to be goal setting and pick those targets and hit those, and those may be the people who prefer to own a wearable and use a wearable and keep looking at their wrist. And then there are others who just don't really need a wearable and just are doing it. And maybe that part of that is because they're surrounded by other people who are just doing it. So, Josh, I suspect you don't wear a wearable device because you're probably in, top 5 percentile of physically active people I know, right? So do you need a device to tell you that you're being physically active? You're probably biomonitoring other things without a device.
Mm-hmm. And I think it's, thinking of some other speculations, Jim, I think one of the important pieces to note too is that a lot of times when these devices are being used in the workplace, either as an incentive or as a way of kind of tracking progress, people self-select to get them. So those that are already physically active, or those people who are motivated to use an activity monitor, might not be the people that would most benefit from the use of it. And so, there are several different ways in which these are used in the workplace, and there's quite a bit of speculation around it, but there's a lot of potential around that piece of it.
Yeah. I think the other thing that's kind of, I don't want to totally ignore from that JAMA study is the possibility that we may, at some level, be, by providing people with this information, causing them to be complacent and believe that, oh, that's enough exercise, and maybe even curtailing some of their physical activity rather than necessarily inciting them to do more. So, understanding, what motivates people to use them and how they use the information when they get it, I think is important.
All right, Danielle asked another question. It says, what are your thoughts on the accuracy of wearable devices and the current research on this topic? I have heard that the Fitbit overestimates steps to provide a better consumer experience.
Yeah, so Danielle, I can't speak to the second part of that. As far as the first one, there is literature on the accuracy of these wearable devices, there's not enough time here today to go into it. But within a certain range, they're reasonably reliable. So internally, they'll be consistent. If you ever go out on a hike with friends, everybody's got a different device on them, and we've done that where we've sort of compared. Well, how many steps did you get at recording? And you'll find that there is variation among devices, but that within a device that, if my Moves program on my iPhone, which just happens to be there, is telling me it was 10,000 steps today, using that same device, and I do 12,000 tomorrow, that's probably comparable within itself. Did I really do exactly that number of steps? It's going to have each device from each manufacturer is going to vary a little bit. And there's actually been some studies done, other systematic reviews that have tried to look at that. And I haven't looked at that in the last year or so, but they're not bad. They're mostly not great. And if you want to use them for, not great to the level of being research grade, if you're trying to do, rigorous research to really know precisely things like energy expenditure, you're probably going to use some more sophisticated monitoring device.
So, during grad school a lifetime ago, we looked at some of these, and the consensus was about a 5 to 10% variance on steps. And so if you're taking 10,000 steps in a day, you might have 9,500 to 10,500, right? So it's about a 5% variance would be pretty typical on steps. And like what Lee is saying, there's probably less accuracy on the energy expenditure estimation side of things than on the steps. And then to highlight his last comment, if you're consistently using the same device, then if you take more steps one day than you do the previous day, it'll do a pretty good job on the same device of being accurate in that sense. So from device to device, a little bit less accuracy, but within the same device, it'll be a pretty good measure.
So let's see Lizzie's question.
All right, Lizzie. How can I use these studies to prove to our upper management that we don't need to give out devices? They are so smitten with them, and I am convinced they are a fad. Have them talk to Lee.
I'm not as down on them as it sounds. I'm just reflecting to you what the scientific literature says. And the scientific literature says that if your goal for doing this is to get a return on investment by changing people's health behavior and getting better health outcomes, there's not a lot of evidence to support that. So, what's going to convince your upper management, Lizzie, I don't know. But I think that if you're able to pose the question, what is your goal for giving out these devices, and outline, is it about engagement? Is it about feel good? Is it about, those kinds of objectives? Then I'd say, get out of the way, let them do it. But measure whether it's changing job satisfaction. Is it changing people's attitudes towards their employer? Is it changing people's participation in wellness activities? Treat it as your own little internal experiment. If they're trying to tell you that they want to do it because they're going to get a return on investment and their healthcare costs are going to go down because of it, I think that's where you have to step up and say, I'm sorry, but I can't find research to support that. If you're doing that, you're making a pretty big assumption. So if you want to do it, that's your choice, but know that there's not a lot of good science to back that up.
And Lizzie, so I would tell you, that was the perspective of the small business owner and the leader, Lee Newman. As somebody who's managed some of these programs before and who's worked with a lot of companies on communicating with leadership these things, the biggest thing you can do to highlight Lee's point is to understand what their intentions are about the use of them. So that's step one. And then your responsibility at that point is to gather not only that information around to evaluate their intentions, but then to also gather some of the additional information that you need. So how much are you spending per year on these devices? I mean, that's a really important one. And if you were to spend that money somewhere else, given what their intentions are, could you be more effective at helping meet that goal? And so, for example, if the goal is, reducing the number of pre-diabetic, employees, and they're using this as a significant tool for that, then you can say, well, geez, if we spent that same amount of money doing something else, we would likely be more effective. I mean, and if you have some of the data to back that up from your own organization, that's a really tough argument to have.
I have sort of a cautionary tale, and then also kind of another thought about this from what you said, Josh. I think that when an organization is smitten with that device like that, that may be an opportunity for you to say, if we go that direction, what the science says is that we should use those devices along with these additional things: coaching, goal setting, creating the social network that supports it. And maybe you want to suggest that if they want to go that step, that they should be bundling it with other activities that fit the more classic behavior change model. So maybe you can use that as a lever for pitching a more comprehensive program, because that's really what's going to most likely have an impact. I'll tell you a quick cautionary tale. There was a city mayor who will go unnamed, who, when I told him that part of what we do here at the center is we address these issues of health promotion, wellness in the workplace, he said, "Oh yeah, I remember somebody coming in to me and saying that every city employee should have a pedometer." This is back in the days of those those old little click on the pedometers, right, on the waist things, right, where people get their steps in by jiggling them with their hands. But and he said, yeah, and so we did that, and we gave a pedometer to everybody, and everybody used them for about 2 weeks, and then everybody put them in a drawer, and that was the end of it. And it colored his perception of the value of all of health promotion in the workplace. And it drove him away from other potentially helpful wellness activities. So this stuff can backfire.
All right, we have a question from Jenna. Do you know of any studies that are looking at sleep deprivation and rest? So are you, Jenna, maybe you can submit a clarifier. Are you talking about that sleep deprivation and rest in terms of using PASDs, or just in general, the workplace impact on sleep? So maybe.
And I would just say that, the studies that I presented today did not attempt to address the use of wearable devices to give people information, or even the use of smart technology of any kind to give people information around sleep and fatigue. There are devices that are used as workplace safety programs that are specifically designed to recognize fatigue. I mean, there's even like a helmet that you can wear that tells you whether you're nodding off on the job, and if you're driving, that actually gives feedback. So, so on the job, feedback on sleep deprivation, i.e. fatigue, that's something that is out there already.
So Jenna gave a clarifier. It's just, so it's the use of a variety of different PASDs, and whether that's an app on your phone or a wrist monitoring like a Fitbit that can give you feedback on how much you're moving, basically, during your sleep.
And fatigue and sleep and monitoring that's a big deal, and I think that should be a whole other subject that we haven't brought in somebody to do a webinar on that. It's high time that we did. It certainly gained a lot more attention and ties into so many other behavioral health issues. You know, when people are sleep deprived, it can result in not only reduced cognitive performance and physical ability to do your job, but it impacts things like depression and other kinds of behavioral health issues. So it would be, I think, worthwhile for us to bring that in at a future date.
So the short answer, Jenna, is likely a giant yes. We haven't spent the time to look at it, but we will have a follow-up webinar, and we'll focus more on fatigue, sleep, and potentially have a section on PASDs in that. And I'd like to highlight that Lee and I just got a kudos in the question line of saying, thank you both, great presentation. And with that, it's 12:57. We are, what do you think? Should we answer a couple more?
Oh yeah, go ahead.
Okay, we'll do a couple.
Make them really quick, really quick.
So another one, wow, it's a long one.
Yeah, there are a lot of the studies that were excluded by the Abadash and Holden review. And the reason was that those excluded studies use wearable devices as a tracking tool, not as an intervention method. But those studies might provide the same evidence that combine wearables and other interventions. The main study goals are more effective. It's just that those studies were not designed in that way. It has never been recognized as a main or a single intervention in the first place by most researchers. I agree with that.
Yep. We are concerned for farmers who work during harvest season, who may work fatigued or operate heavy equipment.
You know, it's a huge concern for lots of reasons. One of which is that we know that among the highest rates of work-related injuries and fatalities are in the agricultural sector. Secondly, we know that those injuries and fatalities tend to occur more towards the end of someone's workday when they're most fatigued, and obviously the relationship, especially for fatalities and dismemberment, are associated with operating heavy equipment. So this is an area where it's ripe for a lot more research, but we already know a fair amount about the hazards, and as far as how well technology can be brought in, wearable technology to help reduce those risks, that's, I think, a wide open area for research.
Yeah. And I would like to put out here too is that Lee and I would love to have these conversations all day long, and that the Center for Health, Work, and Environment is completely committed to helping you and your organizations and the community at large kind of help disseminate the most recent research, and also really dive in and make real life, real work interventions that help people. And so if you have concerns about your workforce, or if you want some advice through either our organization or any of our partner organizations, we'll do our best to provide that to you. So feel free to connect with us offline, and those requests can be filtered through me. My name is Joshua Scott again, and my email address is joshua.scott@ucdenver.edu. Again, that's joshua.scott, my full name, @ucdenver.edu. Please feel free to email me, and we'll do our best to help you out. And with that, it's 1 o'clock, and I hope you have a great rest of your day.
Yeah, take care, everybody. Bye-bye.